I'm Beverly Kirk here with Katherine Bliss. She's the editor of a new report called The Changing Landscape of Global Health Diplomacy, and we're talking specifically about the Americas. So first and foremost, what's the state of international relations in terms of health diplomacy, specifically in the Americas?
There's actually a long history of international engagement on health in the Americas that dates back to the 19th century. And this was when governments in the region began realizing that in order to protect their populations from, in some cases, yellow fever, plague, and other quarantinable diseases, they needed to develop common protocols or procedures for dealing with migration, immigration on the one hand, and port sanitation on the other. Those agreements ultimately led to the creation of a unified or a regional organization, which was called the Pan American Sanitary Bureau, which is actually the predecessor of the Pan American Health Organization, which is now the regional arm of the World Health Organization in the Americas. And so this was from the turn of the 19th to the beginning of the 20th century. Since then, the international engagement between countries has remained very robust, while at the same time, beginning in the early part of the 20th century, private foundations also began playing a significant role. In the United States, the Rockefeller Foundation, for example, began supporting fellowships for public health professionals and doctors from the region from Latin America and the Caribbean to come to the United States and study public health and medicine. And they also began to support projects related to hookworm, yellow fever, water and sanitation, and other initiatives in the region. By the 1950s, the United States government began to support, through its emerging development agencies, projects related to health in Latin America and the Caribbean. Some of these were focused on population, focused on maternal and child health, and on infectious diseases. And over time, other countries also began to follow suit. Canada, for example, also by the 1960s began engaging in overseas development assistance related to global health as well. One of the things that we're seeing about the region is that the relationships on health, while very stable over the course, while there has been a recognition in the region that it's important for those international relations on health to remain stable, there's a lot of dynamism at present. On the one hand, Canada, which has been very much engaged since the 1960s, is really kind of rethinking and seeking to elevate its engagement on global health in the Americas and elsewhere. And then we've also seen Brazil, which, up until the 1960s and a bit later was a recipient of global health assistance or international health assistance, since the 1980s has begun to use its experience in that arena to develop its own outreach on global health. More recently, just in the last few years, we've seen Mexico begin to develop its own international development agency to share its expertise on a wide range of development topics, including global health, and Chile also begin to develop information and expertise in order to share its experience not only in the region of South America but also abroad.
Do you see this type of health diplomacy growing even more between other countries that you haven't mentioned in Latin America?
There's a lot of dynamism at present in South America. For example, a number of years ago, the South American countries came together and created UNASUR, which is the Union of South American Republics. Through that organization, there has been increasing engagement across borders between the member countries, which are those in South America, around such issues as the establishment of the establishment of institutes of public health. Through the CAN, which is the Community of Andean Nations, there have been, there is a convenio, an agreement around health that involves the nations with each other. They work on issues related to cross-border challenges related to infectious disease, water and sanitation, and others. So there's been, there's quite a bit of interregional communication and engagement on these issues. Brazil focuses a considerable amount of its growing outreach on global health within the Latin American region. It shares its experience developing what's known as the universal system of health, the SUS, which is the health insurance scheme or the healthcare system in Brazil with other countries that are similarly seeking to provide universal healthcare for their populations. Brazil and the United States have engaged, for example, in trilateral cooperation schemes on health in El Salvador and others. So.
And final question, how does the intercountry engagement within Latin America impact the overall engagement with the U.S.?
Well, I think, what you're seeing is that there is considerable research capacity and technical capacity and policy development capacity among the countries in the region. And as they begin to, or as they continue really to engage with each other on developing and enhancing their institutions and in working to share their own experiences, both as in many cases recipients of international assistance and in terms of what they have learned with their own experiences, you're seeing the emergence of stronger institutions across the board. Mexico, for example, has been a key element or participant in what's known as the Mesoamerica Initiative, which brings together a number of private foundations as well as the governments of Mexico and some of the Central American countries in an agreement to share experiences around addressing some of the most persistent health disparities, which focus on some of the most vulnerable and marginalized populations throughout the Mesoamerican region. And Mexico has contributed its own public funds to support not only its own participation, but really to share what it's learned, particularly through the southern part of the country, with other countries in the region. And so through that enhanced communication, I think that has led to a greater awareness and interest in becoming more engaged throughout not only the region but internationally as well.
Katherine Bliss, thank you so much.
Thank you.